Good afternoon, everyone. It's so nice to see all of you. And there are a few, some students are still wanting to join in, but there has been some technical issues. But I guess we will start now. Uh, Welcome to this free ADAT webinar. I would really appreciate if you can all keep your cameras on. It's better to speak to faces rather than just names. Yeah. And I would really like and appreciate if this webinar becomes quite interactive. I want it to be very casual. This is specially meant to just demystify everything about ADAT. If you have any doubts about ADAT, I'll be going through how we register, what all universities require ADAT, and if there are any questions, you can feel free to just put them down in the chat. Um, I'm not sure if I'll be able to answer it right away, but yes, definitely towards the end of this webinar, I'll try to answer everyone's questions. So, as you all know, ADAT is the Advanced Dental Admission Test, which all the universities of Canada who take internationally trained dentists for their DDS or their DMD programs, they require ADAT now. None of them require any other exams um, for getting qualified to have your applications put in. So we have had a very successful last year, fortunately, and we had been. Uh, it's we are quite grateful for our students, and it's really delighting to see that most of them have received interview calls either from University of Toronto, University of Alberta, University of Saskatchewan as well. There are a few who are waiting for their interviews at the McGill University, which is no longer an interview now. It's a different format that they have now. Even Dalhousie, for that matter. So I'm so happy to see that our students are shining well. We have got extremely high scores like 660, 670. One of our students received 800 out of 800 in biostatistics, which is phenomenal. We have had high scores like 770 for biomedical sciences. So it has been a journey and a very fruitful one. As we all know, ADAT was originally meant for students to get into residency programs, especially in the US. And some of the advanced placement programs in the US gave a priority to review the applications. Uh, when applied for their advanced placement programs, those who had even given ADAT got a priority in getting their applications reviewed first, because quite a few universities in the US have a rolling basis sort of an application process. So in Canada, it all started back in 2021 with McGill University accepting students with those who have given ADAT, followed by the University of Toronto in 2022, and eventually all the universities followed. Are you going to tell us which all universities ask for ADAT? Yes, exactly. That is what I would be coming into. And you could just please put your questions down in the chat box. Um, Before we just begin, I would like to know, why is everyone here and what are you actually looking for? So this is a poll. Uh, I would appreciate if all of you can just select what you are looking for. That will give me an idea about how this webinar would eventually go. Okay. Okay, so we have almost everybody who has participated. Okay, so as we can see, I'll share these results. Quite a few of you know uh, what is ADAT, and here you are here for your updates. There are quite a few who know very little, and some of you who don't know at all about ADAT. So, did not get the poll. Okay, it should usually come up on the screen, but it's okay. Never mind. Hopefully, you will get the next poll. So, yes. So, as we all know, there are three major pathways for internationally trained dentists or graduates of non-accredited programs, as they say. So, internationally trained dentists, those who are not accredited, those who have done their DDS or their dentistry from programs which are not accredited by uh, the bodies here in the North America. The ones which are accredited are the Canadian universities, Australian universities, American universities, even from New Zealand and Ireland. Those who have done their programs from these places, they usually get an accreditation here, and they just have to give the exam straight away uh, to get a license. But for those who are internationally trained, they need to give their either an equivalency pathway or get into a dental school. So if we talk about the equivalency pathway, why are we here talking even about ADAT for that matter? So uh, just before I get into this, I'll launch another poll just to know what all exams has most of you given, just to have an idea about the kind of cohort that I am speaking to right now. Okay, I hope everybody got the poll right now. Okay, okay, perfect. Okay, so as I can see here, most of you have first time applying. Okay, yeah, no problem. Yeah, no problem. Even if you are applying for the first time, you have not given any exams, that is absolutely okay. Not applied ever, not given any exams. Okay, so there are quite some of you who have not given any exams as well. A lot of them have just given AFK. Some of you have given your NDCC as well. That's very good to know. Some of you have given your INBD. Uh, Very good to know this. Okay, so as we know, for the equivalency path, there is AFK, ACJ, and NDCC, as most of you are aware, because quite a few of you have given those exams. So eventually, we need to give the virtual OSCE just before we get licensed to practice. Uh, for that, either through the equivalency pathway by giving these three exams or getting into the dental school. And there is a newer pathway, which is quite new. The last webinar that I conducted, at that time, the guidelines were not so well defined. But yes, the ACFD, which is the Association of Canadian Faculties of Dentistry, they have come up with a new pathway, which is the GAP program, or what we call as a bridge training program, which is kind of an offshoot of the equivalency process itself. Uh, I'll come to that. I'll explain you how that works as well. So let's look into some statistics before we jump into what ADAT is. So AFK, we have seen a total around 1,800 students giving each time. It has roughly around 33 to 50% of passing rate, as we have seen in 2023. It was a little higher. In 2024, it has dropped a bit. And then ACJ, as we see, it was quite high, which was 81% in 2023. And 2024, we have seen a drop in that as well. And eventually, the clinical skills, it has improved compared to the last time, and the situational has also improved. So if we average out all these examinations, so there is roughly about 100 something roughly around 150 until 2023 who used to clear the entire equivalency process in 1 year. And this year, or sorry, the last year, we saw roughly around 450 students cleared the equivalency process. And the ADAT is actually required for this part. So this also includes the Canadians who are resident Canadians. They have not immigrated or not done their dentistry outside of Canada. These are graduates of Canadian DDS programs, and this is where we are currently aiming into through our ADAT. And so roughly, if we see there's a very less passing percentage, especially the last phase where the situational and the clinical skills are, that is where we have seen people usually get stuck up with. If they have cleared one of the components, they find the other component usually difficult. Uh, and that is where it becomes really challenging. Uh, and I believe that is the main reason why some of you are also here, even though you have given your NDACC. It's a tough process, and it's a challenge for all the ITDs, the internationally trained dentists, to get into the system. But I'm so glad to see that everybody keeps trying. And I would appreciate and I would recommend that you keep trying all the pathways, not just one. We have three pathways. It is best to try out all three pathways. Don't just stick to just one pathway. So as we look into the statistics, there are roughly around 450, as I said, in the last year, the fiscal year that they say, um, who finished the entire equivalency process. So these would be the people who would have given their AFKs and ACJs a year before these statistics came out. Okay, so let's look into the GAP program. As I'm aware, quite a few of you are not aware about how it works. It is also called as a bridge program, and it is actually meant to ease out the process for those who are stuck in the NDCC route or the clinical skills and the situational judgment. So it is something to ease that phase out, and it is more of an offshoot of the first pathway, because uh, so it is something, it is a program which was the federal government has funded it, and they really want to ease it out. So for the first 2 years, it was decided that they would develop the program, and in the third and the fourth year, there will be enrollment into the program. There would be pilot programs running in, and the first pilot has already been selected. And these three are the pilot sites: University of Alberta, Dalhousie University, and Lovell University, which is in the Quebec. So these are the three universities where this pilot program is going to run. So they are having very limited seats right now, and it's a $10,000 program right now. But for the second pilot, it can even increase. And it requires people to finish their ACJ at least, and they should have completed their ACJ on or before, on or after 2022 February. And it could change for the second pilot. They've still not come up with the. So usually these how the pilot programs work is they get in a cohort, they reevaluate what they need for the program, they modify those things in the second pilot usually, and once the pilot programs are in, that is when they finally launch the actual program, looking into the smaller nuances and things that are actually required. And lastly, let's come into the final pathway, which is getting into accredited schools, the Canadian dental schools. And that is where ADAT comes into play, and that is where our role is. Our role is very important, especially to fetch you an interview by getting good scores in the ADAT, and that is where we come up with the courses. I'm going to explain how our courses are, how they are scheduled. We are coming with quite a few interesting changes compared to what we are. We always try to incorporate lots of changes from the feedbacks that we receive from students, and so that our course stays the most relevant for ADAT. So if we look into ADAT, there are roughly around in 2020, that was when McGill had declared that they would start accepting um, applications with ADAT. And there are roughly around 230 applicants, which also includes students who apply for the US programs for getting into graduate programs. And so it can be endodontics, or pediatric dentistry, or even orthodontics. ADAT is one of the requirements. In 2021, we saw a little bit of a rise of students. 2022 was the time when there were quite a few students who gave the ADAT. So the number of students is the first one, which shows here as number of ADAT candidates. Number of ADAT administrations would mean that some of these students give ADAT in the same cycle for the second time. So we did see that happening quite a lot in 2022. Eventually, in 2023, there was a sharp rise. And lastly, in 2024 is when we saw around 1,000 students appearing for ADAT. And that is specifically because almost all universities of Canada required ADAT. And now, currently, uh, all the universities require ADAT only. So all these universities which require, when are their deadlines? When do they start accepting applications? All of these things would be discussed in this webinar. So as most of you would know, and some of you wouldn't, so there are three sections of ADAT. There are 200 questions in the actual ADAT exam. We are going to show you how these sections are distributed. And that is where Dr. Priyanka, who is with us today, she is going to discuss all those things with you. So there are three sections. It is like a tripod. It's a very important tripod with all three components, very important. There are 80 questions for biomedical sciences, and that is the section which I cover for our courses. Uh, then we have the clinical sciences, which also comprises of 80 questions. Dr. Priyanka takes care of the clinical sciences. And then lastly, and the most important section, which is the data and research interpretation, is taken care of by Dr. Sunita. And it is 40 questions, but still its weightage is as good as these 80 questions. I'll explain you, and you'd know better once we explain you how these scorings work. So this is a tripod, and each section is equally important. It doesn't mean that these are more questions and these are less questions, so it is less important. Uh, all these sections, and you have to master all these three sections to get your scores pushed really high. As I mentioned previously, one of our students scored 800 out of 800 in the biostatistics, and that really helps push the overall score. Even if you have done fairly okay in one of the sections, if you are excellent in one of the sections, you can really make your scores push really high. Biomedical sciences and biostatistics, these are the two sections which are very scoring, and they become scoring with the way we are going to train you for uh, in the final ADAT exam. Okay, so let me briefly how our courses are structured, and the next course which is coming up, which would be starting from uh, from July. It is meant for June 2020. It is meant to go on until June 2026. It will start from July. It is run in three phases. The first phase would be viewing the pre-recorded lectures. There are 73 lectures. We have added quite a few from the last cycles. So there are 73 lectures that you go through, and it includes all the three sections: the biomedical sciences, the clinical sciences, and biostatistics. The phase two is when you start giving the tests. So In these tests, there are sectional tests. There will be three section-wise tests for each section, which is 9 sectional tests and 3 mock tests, bringing it to 12 tests in total, out of which there are 3 full ADAT-like mock exams. And we'll be having 15 live discussion sessions immediately after these tests are over. The schedule is already put up on the JADE website and you could review them. And this is a very interesting phase, which is phase 3 that we have come up with. So once the phase 2 is finished in January, you still have time until the ADAT exam begins. And that is the time which we really feel is very important for you to revise and go through things that we have already discussed. The revision phase is what we really feel would benefit students a lot, as most often than not, students lose marks due to the lack of enough revisions. So this is the phase where you'll get reattempts for the mock. You'll still have access to the online content. You'll have email access to us, and something that is really very new and which we are planning to introduce is having regular self-practice tests, which will be a part of phase 1. So while you're reviewing these lectures, we are planning to give out these self-practice tests, which kind of orients you towards these tests. And this has specially been introduced because we got some reviews that after the lectures, it is kind of a lull period for students, and just viewing the lectures, they are not able to test their knowledge. And suddenly the test starts. So these are some smaller tests which actually orient you towards the actual uh, tests that begin from October. So these are the tests which will be taken before that period, during the time when you're reviewing your lectures, so that you're quite oriented and good to go for all the tests. And uh, so these are the same things that I discussed. There are more than 1,200 questions that would be discussed all throughout. You will get printed notes, which will cover lots of ADAT related content, which has also been updated quite a lot from the previous cycles. There are always changes that come up in each cycle, and we keep upgrading with each cycle. And then we have the test series, which is nothing but the phase 2 and the phase 3 of the full course. It wouldn't include the pre-recorded lectures, uh, but it does have the reattempts, and it also has the sectional wise and all the mock discussions which you would be having. So why did we bring these changes? Because we hear you all. We hear our students. So we have come up with more tests, uh, much more resembling ADAT, and that is how the full course and the test series is designed. It is a much more comprehensive course, and we have introduced a crucial component, which is the revision phase, which is really, really, really important for you to score higher than 650 or above 600. So once we discuss the scoring, I'll even let you know what all scores are actually required and what has been the cutoff. I'll rather discuss that when we are discussing the universities. And we have given some breaks between the sectional and the full mocks so that you still have some time to organize your thoughts, organize your reading material once the sectional tests are done before the final mocks begin. Because the final mocks are where you actually grade even yourselves in your preparation compared to the cohort that you are in. So this is the schedule which is already given out on the website. We are having 39 biomedical sciences lectures, 31 clinical sciences lectures, and 3 data and interpretation, which is also in short, I call it as biostatistics. 3 lectures of those, which covers everything that you would require to give your ADAT and ACE it. And then is the phase 2, which would begin from the first week of October, and it goes on until 4th of January, as you can see, followed by which there'll be a phase 3. Yes, the schedule has been put up on the website. It is the same schedule, yes. Yeah. Okay, so let me talk to you about the team. We are a team of three. As I said, the tripod of ADAT. So this is me. I'm Dr. Shrey Pandya. I finished my BDS in 2008, followed by Masters in Oral and Maxillofacial Surgery. Again, from India, I practiced in India for 4.5 years, and I moved to UAE, where I practiced for 4 years as a specialist oral and maxillofacial surgeon. And later, I decided to make things more difficult in my life, and I moved to Canada in 2021. That was when in 2022, early 2022, I started preparing for my INBD, followed by ADAT and AFK, and I gave all three of them and got great scores for all of them. And I applied to 4 Canadian universities, 3 US universities, received interview invites from all of them. Currently, I'm pursuing my DDS advanced placement at the University of Alberta. And I am responsible for the biomedical section, and I've seen great results coming up with that. And I really feel I can continue pushing all your scores higher up. And that's my beautiful wife, Dr. Sunita Dhaka. She is we were batchmates for our BDS, and she did her master's in periodontics. She too practiced as a specialist in UAE and India before we moved to Canada. And she also gave her INBD, ADAT, and AFK between March and August 2022. And she applied to 2 Canadian universities, and she eventually got acceptances in the IDAP program of the University of Toronto and MSc program in Perio in University of Alberta. And she's currently pursuing a residency program in periodontics here at the University of Alberta. And her strength lies in the comprehensive understanding of and applications of biostatistics. And she is the one who helped me clear my biostatistics exams when I gave my ADAT as well. So all three of us, as I said, the tripod of our ADAT course, all three of us have given our ADAT, and we have really scored high in ADAT. And that is where we are still able to deliver good results for ADAT. And here we have Dr. Priyanka. She she is here with us, and I'll hand over the mic to her to introduce herself. Yes.
Thank you,
Yes,
Dr.
Dr.
Shri.
Priyanka.
Thank you. So, my name is Priyanka Suri, and I'll be taking your recorded lectures for biomedical and clinical sciences, as well as your live discussions for the clinical sciences tests and mocks. I graduated with honors back in 2013, and after that, I practiced in India for 3 years before moving to United States. And then in United States, I pursued a 2-year program in clinical research and clinical pharmacology, followed by which I did 2-year residency from University of Southern California in Los Angeles. And besides that, I took the NBD boards, AFK and ADAT, and I've been invited by multiple schools in US and Canada. And finally, I ended up taking the opportunity to pursue DDS from UCSF, that's University of California in San Francisco. And besides that, I'm really enthusiastic about helping candidates who are taking interviews and making CAPIT profiles. So I have been also a part of interviewee committee as a student ambassador at UCSF. And I've been also an active member with conferences and events alongside ADA and ADEA, which is Educational Association for ADA. And that's about my profile, and I'll be happy to help you throughout this course. Thank you.
Thank you, Dr. Priyanka, for this introduction. So let's discuss about which universities require ADAT. When do the application cycles begin? This is a very important part. You can take your notes if you want. This webinar would be uploaded on the JADE portal as well, and we will try to upload it on YouTube as the previous webinar as well. So there are always some changes that come up. Even between my webinars, there are quite a few changes. I'd taken one webinar in December, and later there has been a few changes. I'd taken one in July before that, and there have been quite a lot of changes ever since. So every webinar has some new information that comes up. So to begin with, it's McGill University, which is usually the first to start their application process. It begins somewhere around mid January. They have a newly introduced program of 3 years. Previously, it was a program of 2.5 years, but now they have a new program which is of 3 years, and it begins from fall. Their application cycle begins from mid-January until the 1st of March. And this cycle, they were accepting the ADAT scores for until the 10th of March. That means that for those who appeared between the 1st of March to 10th of March. So ADAT is held between 1st of March to 31st of August. That is the only time period in between which you can appear for ADAT. We'll discuss that further once we are talking about how you register for your ADAT, how do you book your exam dates. Dr. Priyanka will be talking about those things. So it has roughly 8 seats, out of which roughly around 3 students are I'm sorry, it's roughly 3 students are from Quebec, and there are more students who are not from Quebec. They have not given that out right now on their website, so there might be changes to this section. So you might want to ignore this. This was something which was previously relevant, and we feel that it could be the same. They usually don't make drastic changes in uh, the way they divide the cohort, but we would get to know soon once uh, the cycle closes. So there is a manual dexterity test, which some of our students are appearing for, who have been chosen for the interview process. So we'll get to know how many students have been eventually getting into the program. And yes, yeah, French is a requirement, and French is compulsory, and you can't give your application without knowing French, and it requires a B2 level or an intermediate level of French. You could go into their website for knowing further. If you are a Quebec resident, you would also be eligible for the quota that they have for Quebec residents. So, and then is the University of Toronto. It roughly has around 24 seats, and these seats keep varying. So for McGill, for Toronto, it depends on how much of space they have from the previous cohort, and that is how they vary. Previously, University of Toronto has even had around 22 candidates, 23 before, and this year they took around 24. So every year there is roughly around 24 students that they take in, give and take 1 or 2 students. And then is the University of Alberta, which has 20 seats, and their application cycle starts from the 1st of July until the 1st of November. It's a 3 years program. Then we have University of Saskatchewan, who takes applications between the 15th of December until 1st of February. And it has roughly around 10 seats, out of which at least 1 seat is reserved for Saskatchewan residents, and at least 5 seats are reserved for their clinical. It is kind of a manual dexterity test or a clinical bench test that they have, and roughly 5 students are reserved for five seats in that section is reserved for Saskatchewan residents. So then we have the University of Manitoba. Previously, it had two pathways, the track A and the track B. Now the track B has been suspended until further notice. We would get to know probably in my next webinar. There are changes to that maybe. And track A, it opens roughly around in November, and the application cycles go until the 1st of April. It is a 2 years program, but they take and interview students 1 year prior to the students getting enrolled. So it it would take roughly around 3 years for you to finish the program. And the program is, although for just 2 years, once you start, you finish it in 2 years. Then is the Western University. It is also a 3 years program, and the application cycle run from mid-September until the 1st of November, and it roughly has around 20 seats. University of Manitoba, I'm not aware of the number of seats. Um, it keeps changing, and they have not given that out on their website, so I wouldn't put a number on that. Quota for Ontario people in Toronto. I'm not aware of any such quota. If there is, they would have given that out on their website, but they have not mentioned that. But there are quite a few things that they look into. It's not just the ADAT scores, it's also your um past GPAs, which are looked into, your interview scores. Everything is compiled and it is looked into for University of Toronto, and most of the universities look into that as well. So the total seats in Alberta, no, it's 20. Dalhousie University, it is again a 3 years DDS qualifying program, and they take up to 6 candidates. And the deadline for their applications is usually the 15th of January. There are still students awaiting the interview calls for Dalhousie University. So roughly, if we combine all these universities, we have roughly around 95 to 100 seats in total all over Canada that you would be eligible for by giving your ADAT scores, by giving your ADAT and faring really well. So how do you register for ADAT? What do you need to do? I'll pass on the uh, mic to Dr. Priyanka, and she would be the one explaining you about that now.
So starting with the registration for ADAT, you need to create a dent pin, which is there on ADA website. So all you need to do is just to Google how to create a dent pin or create a dent pin, and you'll be navigated to the site. And after entering your details, it would give you a dent pin. So this pin you have to keep with you throughout, because this would be required for any ADA conducted test, be it an INBDE or ADAT. So this dent pin is important, and it can be recovered like with your email and anything, if just in case you lose it. So that's about it. And followed by that, you need to have ECE evaluation. And for ECE evaluation, it's basically it converts your grades from your home country or the university to the EC grade metric, the United States grade metric equivalence, and that report is ECE. And usually you get a grade point average score, which is out of 4. So most schools require 3 plus, if I talk specifically about the United States Central Schools. So 3 plus of GPA is a minimum requirement, and above 3.5 is always a competitive GPA. And for this, you have to pick US evaluation report and not the Canadian one. So this is important because you're applying to ADA. So that would be the United States evaluation report. And then for the address or where you have to send this report, that's JCNDE. That's the Department of Testing Services, which is located in Chicago. So this address is important. That's where you're sending your ECE report. And once your report is evaluated by them, then only you will be able to register for the ADAT. And which report to select? So here there are, on the website, you'll get many options. And out of them, you have to pick the course by course report. So this report would convert all your courses semester or annually, however way it was in your university, to the United States equivalents. So that's the one that you have to pick. So please remember course by course report. And then talking about the ADAT testing window. So the ADAT testing window starts from March 1 through August 31st. And that's the only time you can take ADAT in 1 year, and then it would be the next year when it opens around the same dates. And then talking about the administration schedule, you'll have a total of 200 questions. Out of them, 80 would be biomedical sciences, followed by a break, and then 80 from clinical sciences. And clinical sciences contains both case-based and standalone items. And followed by this, there would be another break, and then 40 questions on data research, interpretation, and evidence-based dentistry. That's basically your biostatistics that would be tested. And the number of questions for biostatistics are 40 compared to 80 that we had in biomedical and clinical sciences, but the scores would be reported at a same metric. So that would be similar. So you'll get a score out of 800 in each of these components. And then the total score would also be an overall score, which is out of 800. Then talking about the fee, so on the website and also on the ADA examining guide, you would find the fee for examination for additional score reports, and there is another fee for non-accredited dental school candidates. So anyone who graduated internationally, of course, those who are taking ADAT here, because ADAT is also for the residency exams, for the selections like for residency application process. So that's why they mentioned for non-accredited school, there is separate fee. And then there is audit fee, which is optional, but I have never seen scores increase or decrease during audit because it's all based on scaling of scores and grade assessment. So I have never heard like if audit would ever change the scores. And then there is rescheduling fee, so you can reschedule. Then talking about retesting, it is really important. We get a lot of questions about it. So the retesting window is 45 days. So you have to wait for 45 days in order to take another attempt. And per cycle, you can only take 2 attempts. And after that, it would be limited to 1 testing attempt if you have taken ADAT more than like already 2 times or more. And then talking about the curriculum. So starting with biomedical sciences, there would be 80 items in total. Out of them, 20 would be from anatomy, 20 from biochemistry and physiology, 20 from microbiology and pathology, and then 20 from dental anatomy and occlusion. Then for clinical sciences, you'll have case-based items, which means there would be a case scenario with patient demographics, patient's chief complaints, clinical findings, pictures, also radiographs, full mouth series, and periodontal charts, depending on what question they are testing you on and what discipline they are testing you on. And besides that, there are total 80 questions in total, which would contain standalone as well as case-based items, and that would include all the components of clinical sciences of dentistry, for example, endodontics, operative, and so on. And then the third component is data and research interpretation and evidence-based dentistry. There would be 40 questions, which would be testing you on study designs, data analysis, research interpretation, inference, and implication. And Dr. Sunita is really great at it. And then talking about an example of dental chart. So this is a dental chart or dentogram that you can find there, and that would indicate the teeth, for example, requiring restorations or which have endodontic treatment undergone, and everything about the teeth that they want you to see in picture form that would be represented on dental charts. And besides that, there would be periodontal chart that would contain probing depths, gingival margins, and such things. So all the information that you need to have a periodontal diagnosis would be there on periodontal charts. And we will be practicing these during the tests and mocks. So you'll get more familiar with it. Then this is the patient box. That's how they would present the patients to you. So the first column that would contain the patient demographics, followed by chief complaint, patient's background, patient's history, and then the current findings. And along with that, you will get other information such as radiographs, perio charts, or clinical images. Then talking about scoring. So the score it ranges from 200 to 800, 800 being the maximum. And the score is in a system which is a 10-point increment, which means either you'll have a score of, for example, 710 or 720. There would be nothing in between. So it increases in increment of 10. And we had a highest scorer of 730 in ADAT. And also for specific disciplines, for example, as Dr. Shray said, for data interpretation and research, we had a top scorer scoring 800. And for biomedical sciences, this cycle, we had a scorer of 760 and 770, which is 99th percentile. And then for the scoring system, these scores are analyzed in a psychometric equating process, which means it's not a raw score, means it doesn't correlate with the number of correct answers you have. And there would be some questions which would be just experimental and they would not be scored at all. So there is a proper scaling process, and that's how they give you out your scores. And also there would be no negative marking. So if you answer something wrongly, you won't be penalized for it. And then talking about the frequency distribution. So that's the overall scale for 2024 among all the testing administrations, which were 1131. And you can see the mean score, the average would be in the range of 500-ish, and then the highest going towards 100 percentile would be in the range of, like, there would be very less, although, but the higher would be in the range of 700s, late 650s or 700s.
Yeah. And some of our students are amongst the top 10 with 670. So they were around in this range, which is in the top 10 of all those who have given ADAT, which is phenomenal.
Yeah.
Yeah. Okay, so this is all, and these are the email addresses for all of us. Um, and we have designed our course quite comprehensively so that we cover each and every aspect required for you to appear fully prepared for your ADAT exams. And you can ask any of us any questions if you like at any point. We would be more than happy to answer your questions. And I'll open the chat box now, and you're free to ask any questions that you